Hey everyone, this is Jack Hinrichs from Nysterman Associates, Director of Training and Development. I want to talk to you briefly about depression and isolation. There are those who are struggling right now with depression, and I want you to know three things mostly. Number one is you're not alone. According to the Worldwide Health Organization, about 300 million people worldwide suffer from depression. So it's the world's leading cause of disability. Just in the US alone, there are 16 million estimated who struggle in the US with major depression. There are some different kinds of depression. There is major depression. There is what we call dysthymia. That's a chronic, low-grade, low-level depression, depressed mood that lasts for more than 2 years. There's a bipolar depression, which makes up about 3% of the population. There is seasonal depression, about 5% of the population, and postpartum depression. Besides the fact that you're not alone, I want you to also know that it's not your fault, meaning that the three major causes of depression are brain chemistry, hormonal changes, and genetics. So some people are just predisposed and vulnerable with their genetics for being depressed. There's also situational depression, so it could be circumstances that cause depression. Oftentimes, it's a combination of genetic and circumstantial depression as a cause. The symptoms of depression are irritability, low self-esteem, a sad mood, lack of energy, trouble sleeping, trouble concentrating, lack of appetite, sometimes a stronger appetite, weight loss or gain, thoughts of death, and thoughts of suicide. And so if you're experiencing any of those symptoms, the good news about depression is that there is effective treatment. Depression is very treatable. So far, the research has shown us for several years that the best treatment is medication combined with effective evidence-based therapy, which is usually CBT, cognitive behavioral therapy, or DBT, dialectical behavioral therapy. So those are the main approaches and treatments for depression. Again, it's very treatable, it's very doable. The main thing I want you to know is that there's no reason for you to suffer needlessly. You really can get help. There's help available, and I encourage you to get the help and to get the treatment necessary for the depression. And during the time of the pandemic as well, really be careful not to isolate. You can still socially connect without and practice social distance. And so those are just some brief thoughts for today. Again, do yourself a favor, get the treatment that you need. It's available, it's effective, it's very helpful. Thanks, talk to you soon. Bye.